All right. So, Pam, thanks so much for joining us today. I have a couple of questions for you as one of our clients. And this is just pertaining to Client Appreciation Month. We're interested in getting your perspective, how you're doing with your therapies, and essentially your story and your journey throughout your recovery. So, one of my starting questions is just, can you tell us a little bit about yourself and why you decided to pursue physiotherapy services with Propel Physiotherapy?
Well, my stroke journey began in June of 2019 with a series of headaches leading to carotid artery disease diagnosis and subsequently a diagnosis of AFib in the heart with a stroke experienced in mid-August 2019. And there were no physical warnings, and AFib is difficult to diagnose without an incident. The stroke incident involved an efficient and timely response by EMS personnel and fitness emergency response team at the Chestnut Developments Recreation Complex in Pickering, transporting me to a stroke division hospital, Lake Ridge Health, Oshawa. The staff at Lake Ridge Hospital were very supportive and prepared to meet the ER conditions and aftermath of the stroke by administering the TPA medication. I was within the 4-hour limit. My limitations are minimal compared to the average stroke patient, left hand dominant and arm affected, and I continue to work with an excellent rehab team consisting of an occupational therapist and neuro-physiotherapist for improving my quality of life towards positive functioning qualities within the community. I left Lake Ridge as an outpatient and received rehab at Whitby Hospital for 12 weeks, and then I sought out the private OT and neurophysiotherapy that I'm presently experiencing. And I believe it's very important to have continual rehabilitation with stroke. I think it's timely, because it is timely with stroke, to get the best stroke care practices within the short time frame and reach that positive independence in the community. I then experienced, I guess, September 30 this year, went for a nuclear test, and they had to stop the test halfway through because they found the heartbeat was low, which is a bradycardia condition, and I had to have an emergency pacemaker implanted on September 30 of this year. And I'm recovering from that. I'm about 5 weeks in, and I have been re-enrolled in the rehab Central East Cardiovascular Rehab Program of Centenary, which I was in 2 years ago for the stroke. And I am connecting this week with my therapist to reinstitute my exercise program again, because I was walking 10 miles a week, but that has kind of subsided through the pacemaker recovery period.
So this last couple of months has really been I would say, a whirlwind to say the least for you. I mean, I think it's eye-opening in that aspect, and you've been such a great advocate for not only yourself, but also other stroke survivors or other people who are in similar situations, just trying to find their way in recovery and rehabilitation. What has been the most eye-opening aspect of your personal rehabilitation journey so far, Pam?
Well, I would say that the rehab program that I had out of Centenary was most beneficial. I'm very much an advocate of that. Changed my life in terms of diet, exercise, losing weight, which are all part and parcel of these two conditions of AFib, which caused the stroke, and now the low heartbeat. In being in touch and having a consultation with my cardiologist recently, he has indicated that to control the carotid stenosis, which I do have blockages on both sides of my neck, it's an aggressive medication therapy. It's maintaining your diet, your weight, your exercise regimen. I would also say with stroke, it's the repetitive exercises that is so required each day to try and achieve that level of functionality. So it's been very beneficial to have the private OT and neurophysiotherapy. especially now, even with the pacemaker, because now being a little restricted right now until I start to reinstitute the exercise therapy, it's very important to have those team members on board to instruct you accordingly so that everything goes well with your recovery with the pacemaker, as well as you continue your stroke therapy, which is so important. And I do believe it is very timely to have that therapy shortly after the stroke.
Yes, I would agree with you. Biases all aside, but how do you feel in general, like how you're progressing post-stroke with regards to your rehabilitation, and what are your goals in the long run for your rehabilitation?
Well, I feel that even just the minor kind of exercises I've done since the pacemaker implant, I find that my hand, now that it's open instead of clenched as it was in the beginning, is being able to do certain functions like zip up a jacket. I'm able to now do that and hold on. I'm using my left hand more for functional tasks. I find that my goals would be maybe to get my writing to a little better standard. It's not a real issue because I can manage with my right hand if I have to. But that would be a goal. I would also see more functions with my left hand. Sometimes there's weakness, sometimes there isn't. That's all part of the therapy, I think. And if I can become a little more functional in terms of that. But I'm a bit ambidextrous, so that's assisting me, I think. So
For sure, for sure.
but I can drive now. So I can't drive right now with the pacemaker recovery plan, but I can drive, which was one of my achieved goals, and I'm happy for that.
Yeah, that was a big kind of like milestone for, I think, for, obviously yourself, your family, and independence, right? I think that's always one of the guiding lights for rehabilitation and physiotherapy and occupational therapy as well. I think what I wanted to kind of pick at to kind of put the client or Pam, yourself, in the spotlight is we've had a good amount of sessions together. And I think what always inspires me for providing treatment to clients is seeing that the clients are really into their program and taking things really seriously and trying to be advocates for yourself. So I ask this to many of my clients that are advocates and leading the way: what drives you the most? And or if I had to phrase it differently, like what lights a fire for you during your rehabilitation process? Because I can only imagine not every session is like the rainbows in the sky, lollipops kind of session, right? So what is it that drives you the most?
I think it's like my therapy and my education with my therapy has been most beneficial. And I really find I'm driven not just for my own personal rehabilitation, but for the rehabilitation of stroke survivors in general. I'm very interested in getting that education, those contacts out to the community, which I did with World Stroke Day on October 29. I'm interested in advocating with the in conjunction and integrated services with the rehab cardio program as well, because it's all interconnected. And I've made those contacts. I've made a contact with my cardiologist as well, who wants to be part of that process. And that encourages me and motivates me that we can send those messages out to the community, to stroke survivors. I truly believe there is hope. There's inspiration, and we can achieve those objectives for a healthy lifestyle. We may not return to normal, but we can return to a level of functionality which will assist us in our own lives. And I think that's really what spurs me on to get that education, those rehabilitation processes out there. Because I believe that there needs to be those contacts over and beyond our OHIP funded physiotherapy clinics, because there's not longevity in those kinds of venues for OHIP funded. So I think we need to educate out there, and that spurs me on personally.
So, I mean, that's a great kind of response. And what I've learned across the time of, providing treatment for different people, is that light or that fire is really individualized for each person. So, I mean, even verbalizing it and kind of giving that an avenue for other people who have survived stroke, other people who are going through their own rehabilitation and processes. I think that that's a nice little key take home, right? For you and the clinician to work together for goals, which is great, but for you to really ask yourself, what is it that's going to motivate me to get better? And that's asking your why, right? And that's amazing. Thank you for that response.
Mhm.
And to put you in the hot seat, so to speak, or the spotlight again, I'll ask another question that's, if you could give advice to others who are in similar situations, and it doesn't need to be post-stroke, just someone who's going through their own rehabilitation, what would that advice be to that person? And let's break it down maybe from when they first start their rehabilitation process with whoever their healthcare provider is, to the midway point, and maybe, if it's been going on for a long time, what advice would you give to those kinds of patients and clients?
Well, I think it's important once you're in the hospital to be educated on the direction of where stroke recovery will go. I think it's important to seek out the resources for stroke recovery, and that can be through March of Dimes or Ontario Heart and Stroke Association. There's many educational programs out there. There's also after stroke groups, which I am a part of one of them. And in Durham, there's a number of stroke recovery groups out in our area and region that you can connect with to get information. I think it's important to take advantage of the OHIP funded programs to at least find out what your options are and the venues out there. And then I think it's also important after that ends, which are OHIP funded, to find the right team that can work with you, both occupational therapy and neuro-physiotherapy. And it should be neuro-physiotherapy, not just general physiotherapy, to work with your various challenges, whether it be cognitive, whether it be vision, hearing, mobility issues, which many have, because I truly believe that you can get out of that wheelchair. You can achieve results. It's just going to take a lot of repetition, and it's going to take dedication. So I think as I move along the journey, I find that it's important to continue with some kind of continuum of care, because things are changing, even I find now after 2 years, with just what I can do with my hand, and it surprises me.
Thank you. Yeah, I mean, you bring up a good point, that hot buzz term of continuity of care. We often say that to our clients who are being discharged from like rehab settings or inpatient settings, that, it's important that just because you get discharged from the hospital, to remember that in the hospital, you were receiving a pretty high frequency of, some sort of therapy, or someone's checking up on you, or like essentially pushing you to do stuff, right? And sometimes when people do get discharged from to home, it's a question mark in the air, saying like, where do I go from here, right? Maybe there's more concrete guidance for return to work or return to sport or return to livelihood. But maybe if we don't have those avenues or that kind of support from our employers or, other organizations, it is a little bit of a question mark or a blank mark for people. So, I mean, I think that kind of advice to seek out the correct correct supports is really important. And to know that there are some supports out there funded by the government that are, free in a sense, and we just need to find them and stay connected. All right. Last two-ish questions, if that's okay with you, Pam. What do you enjoy? And this is a loaded question, so I'll preface it with that. What do you enjoy about physiotherapy and or occupational therapy, if anything? And what do you not enjoy the most? I think that's important for other health providers to understand and get your perspective.
Well, I would say I enjoy, through occupational therapy and neurophysiotherapy, I enjoy the education. I enjoy the discussion that we have to to enable me to understand why certain things are happening, whether it be spasticity, whether it be using a biostim NMS machine in different areas, which I have been told now I can still use, which is great news because that helps, I believe, my therapy. My cardiologist said it won't interfere with my pacemaker. So I enjoy those kinds of discussions. I think there needs to be that balance between education and your therapy. There's really nothing that I don't enjoy because I just find that
you can be honest here. You can be honest here.
every
No
useful
problem.
piece of information I get, I can take it home and work on it independently. And I'm given great instruction on that. If I wasn't given good instruction, that would be a challenge. But I get great instruction. And like I said, it's all in finding the right team that's going to work with the stroke condition or the complexity of cognitive, if you have that, speech as well, aphasia. Many people come with that. Like I said, I consider myself very fortunate and blessed that I only had my left side, my left hand actually go down and nothing else. So I can still try to carry on. I'm educated on weight bearing and other tasks that I can maybe perform. I have to be careful about balance. So balance I work on. So I just feel we just kind of cover all the spectrum of different things that could affect my rehabilitation. And I think that's a good thing.
Got it. So, I mean, what it sounds like is you enjoy the education and discussion and let's call it the talking back and forth and understanding why certain things are certain ways and why we're at a certain stage of recovery. And you brought up a great point, like why, now we can use the stim despite having that little bit of a complication, right, with regards
Yes.
to the pacemaker.
And I think it's very, very important to address spasticity. Many people don't, or if they do, they are questioning it a lot. We find that in our after stroke group. And I think, I'm looking forward to having an assessment, a new assessment again on that. I have had 2 injections, but I'm looking forward to that because I listened to then another perspective on how to get rid of spasticity in the forearm and in the hand. And then that will move me maybe forward further on my hand therapy.
Right. And that's, I think you brought up the best point in the end. It's like those clear instructions. We really need to make sure that, the patient or the client leaves the clinic with understanding what we need to do. Because, I don't see you every single day or hour of the week, right? There are gaps in between our schedule, and it's like, what are you doing in between those times? That is really also very important. So you bring up a good point.
I've also heard from one colleague as well, and I can say the same as, when the stroke happened, I thought, oh, that's okay, I'm going to get better, I'll be better in a couple of days. And I heard that from another colleague, and that's just not the way it happens. It continues, and you don't realize that the stroke can be debilitating for a number of years onward. And that's why it's so important to work repetitively at everything that you're given to the tools to work with.
That's a great point to wrap up that question with. I appreciate that. If you could tell a health professional, physiotherapist, occupational therapist, even an exercise therapist or a massage therapist, that's just kind of like starting their career and wanting to go into perhaps stroke rehab or post TBI rehab in the neurological field, what would you want to tell them so that perhaps your patient or client experience can help shape the way that they practice with their patients and clients?
Well, I would say I would certainly share some of my advocacy challenges in terms of stroke. For rehabilitation and therapy. I know that in discussion with people, we could see an integrated service across the GTA, Toronto, and even in the province, which is what we're looking to advocate for. I think it's so important everybody's on the same page, offering the same rehabilitation processes, which certainly would help, as you had mentioned, particularly getting young people back to their post-secondary studies or to a position, a job. So I think that it's very important that they understand the challenges a new physiotherapist or a new OT of what a stroke patient faces, a cardio patient faces in terms of rehabilitation. It's a long process, and I think they need to give that education to that patient, and they need to support that patient with any therapy processes they can provide, and it's not an easy task. So I would say to be successful and feel successful, that those kinds of points are very important for a new person starting out, to understand all of that and the education behind it.
Those are really well documented points. I was typing frantically with my mic on mute because you bring up a couple of really good points that a lot of junior physiotherapists, self included when I started, there's an aspect of wanting to rush things or being impatient. And I think, like anyone else, we want to help our people, help our clients and patients as fast as possible, right? And same with the clients, we want results as fast as possible and as efficaciously as possible. And depending on the type of injury, central nervous system involved, or even peripheral nervous system involved, and in this case, perhaps even other systemics involved, that things take a little bit longer. And I think having the stick-to-itness or the ability to kind of like steady the ship and look at the long term helps with not only the clinician's perspective, but the client's perspective as well. And I think that has helped in our, rapport building, but also the fact that you're able to interpret the information and apply it and see the differences that you want to see. I think that's wonderful. And that kind of sums up why we wanted to speak to you and get your input on how we can help our other physiotherapy colleagues have another positive patient perspective. So,
and the other thing I was going to mention is I think it's important to be part of any studies that are done either on stroke or cardio. And I actually may be involved in a study at St. Michael's Hospital of graduate students who are doing a genetic marker for carotid stenosis. And that's important to know because carotid stenosis, I don't know, was maybe connected with the stroke, maybe not, but it's something important to know. Did I have that most of my life? I asked how I could have stopped it. It's really a difficult issue to stop because it's a hardening of the arteries. So basically, I'm interested to participate in that and see if they come up with any conclusions.
Yeah, you bring up another great point. Participate in these kind of government-funded or scientific community-funded studies where you can learn a lot more and there's more discussion to be made, and the networks around that are quite phenomenal. So I think, I mean, my last little bit here is, are there any parting remarks from yourself or comments that you would like to really let anyone else that is clinicians, colleagues, fellow clients, or patients know about your journey?
I would say that I'm quoting from recent statistics of the Heart and Stroke Foundation. In just 3 years, heart and stroke has increased from 59% to 76%, the number of their funded research projects that include sex and gender-based analysis and reporting, but there is more to be done. So that's unquote. And I personally, I will continue to bring educational programs and advocacy topics forward within our community and province for best stroke care practices that we can continue to provide so that patients can achieve their objectives for a healthy, functional lifestyle. And I'm just quoting from an author I have, Roy T. Bennett, The Light of the Heart, or Light in the Heart. Don't wait for the right moment to start. Start and make each moment right.
That is a great quote. I will have to ask for that again in writing sooner than later. Pam, thanks so much for taking the time out of your day. If there's anything else that you'd like to discuss or like share with regards to your client experience or patient experience, please don't hesitate to let us know. You can do it in writing if you don't remember something to say today. Right now, I will just put the recording on pause.